Now, all healthcare providers are well aware of their regulatory cost report filing requirements. They know that if they do not prepare a proper cost report, they risk their Medicare and Medicaid funding. That's not a good thing. But beyond the regulatory filing requirements of a cost report, the cost report has become a tool with many different uses. First, the cost report has become a tool for management. Providers are using their reports in lots of interesting ways. They're using them to determine profitability and financial performance. They're using them to evaluate their labor costs and to determine whether their spending by cost center is appropriate. And in many cases, they're using them to maximize their third-party reimbursement. But financial managers must also realize the implications of their cost report filing, because others outside of the entity are using these reports as well. We know that Medicare and Medicaid contractors use the reports for desk reviews, audits, and quality measurements. We also know that federal and state agencies use the reports for rate setting and to determine compliance with spending and laws and regulations. We sometimes forget that others outside of the provider are also using the reports, such as lenders, lessors, and contracting entities. They're using them to determine the financial stability of the company and to decide whether to enter into business with the company. Also, since the reports are largely available to the general public, now competitors are using the data from these reports for comparison purposes. They're using them to determine whether labor costs are equal, to determine quality measurements, and using them in all sorts of ways to compete with the provider. We know that cost report preparation just doesn't begin when the preparer sits down to prepare the report. It is an ongoing process in which the financial managers and the preparer must be up to date with financial standards and accounting standards and laws and regulations, and that all staff must be educated and on board.